The GPS report tells us several important pieces of information. First of all, it gives us a risk of adverse pathology. Adverse pathology can be a factor in long-term progression of disease. Adverse pathology is defined as either having Gleason 4+3 disease and or extracapsular extension or T3 disease, which could be seminal vesicle invasion as well. When you use the test a fair amount, you get a better feel for what's a favorable indicator or what's an unfavorable indicator. So Gleason's score, we find, is not necessarily the best predictor of finding out whether you're going to have adverse pathology after prostatectomy.
So the adverse pathology endpoint is probably the most useful and meaningful component of the report in my mind. I think when patients and I are considering active surveillance as an option for patients with either low risk or low volume favorable intermediate risk disease, I think what we're most concerned about is the progression to a Gleason 4+3 or having other adverse feature qualities in the future. And so because there are so many unknowns in the world of prostate cancer, by understanding or putting a value of the chance of that adverse pathology happening, I think either assures the patient that they're making the right choice for active surveillance or appropriately leads them towards treatment. So I think it helps the confidence for both myself as the treating physician as well as the patient who is trying to decide what is the appropriate course of treatment.